Welcome. Thank you for joining Consumers Doc 1 channel, Dr. Bengala. Today, the comparison between universal healthcare and consumer-driven healthcare. That's an interesting topic to talk about, folks. Yesterday, I just met a gal. Her name is Erica Gonzalez. She's a very well knowledgeable. She's a valedictorian from high school. She has lots of progressive agendas. One of the things was she wants to run for Congress for universal health care. Then I came with an idea, why not we compare universal health care to consumer empowered health care? First, universal health care, I like the idea. I would love to take care of the people who can't take care of themselves. There is one problem with it, folks. Simple solution. When somebody gets for free, then they abuse it. It's a human nature, man. It's a human nature. You give it for free, they abuse it. It doesn't work. Universal healthcare is a concept of socialized medicine, which is there in England, Canada. It is a failed system, folks. America will never tolerate that. Never tolerate. To get to see a doctor, you have to wait in line. To get to go to the clinic, you have to wait in line. Simple things. And it's a class system, folks. Class system. You have it or you have not. If you have it, you can pay and see the doctor right away. But if you have not, you have to wait. So it's a class system which will never work in the United States. I can guarantee you that. Universal health care is not a practical solution because it is completely run by bureaucrats. You know how the bureaucrats run? Typical. You can see any bureaucratic organization, it is dysfunctional. There's no accountability. There is a unionization, and everything you need a paperwork and paper trail. There's lots of drawbacks, folks. What I'm talking about, consumer empowered healthcare under the public-private partnership. Yes, public-private. It is not completely public like a universal healthcare, but is a private partnership is involved. When you have a public-private partnership, that's the beauty, folks. That's where you can achieve a lot more things. For employers and employees, they benefit from the public-private. I'll give you a typical example. Yesterday, Erica called me saying that, hey, there is a mall which has been closed for a year, more than a year. It's not going to open. 450,000 square foot mall. I'm not going to tell you the location, but it's sitting empty, completely locked down. Because of compliance issues, whatever, the developer could not hold it and county took over. Yes, and this mall has been sitting empty. What I would like to do is, under the public-private partnership model, under a non-profit umbrella, I would love to have this project. You know why? Because this is my goal. This is where I stand. Under the public-private partnership, we will give insurance, high deductible health plans to all the employers in that county. Everyone gets insurance. Everybody gets insurance. Somebody who applies for insurance, they're denied. If they get denied for whatever the reason is, Health Review Authority under the public-private partnership, which is a liaison, monitors all the insurance companies. When the applicant is denied, they step in. They review the application. If it's truly uninsurable candidate, they'll give you a certificate of guaranteed coverage. Certificate of guaranteed coverage. And they will get the best care as person who has insurance. It's almost as if that they have a private insurance, folks. These are the people who are economically impaired, physically impaired. They have the amenities, they have the access to healthcare like anyone else. Okay? Once you do that, when they get a deductible, employer gets a deductible health insurance. For employer, it's a savings. You lower your cost of the health premium, and employer gets to keep the savings and invest in the workers and buy them health savings accounts. Yes, folks, health savings accounts. The health savings accounts, which is tied to the Ameritrade, you can invest in the index funds. You can invest in the, you name it, folks, index, NASDAQ index, you name it. If it is done that way, the consumer who has the health savings account with money tied up in the brokerage account, so they have a savings account with a debit card. That's the beauty. Once you have that, every time you go to the doctor, if they ask you, do you have health insurance? Sorry, I have a deductible, so I need to come up with payment. So how much is it? Anyway, I need to know. You know what, folks? If you're paying cash, your cost is 30 cents on a dollar. I'm not kidding, man. They say there's an MRI, if they bill the insurance company, they bill it $5,000. If you pay cash, it can be done for $500. That's how it is, folks. If you pay as you get the care, the costs are lower. You're getting rid of the middlemen. You're getting rid of the managed care organization. You're getting rid of all the billers. That itself is 40% savings, folks. 40% savings. And the contributions to health savings are so easy. Employer can put in whatever money saved from the deductible health plan, he can contribute, and employee can contribute half. So 50-50 partnership on the health savings. I'm talking about for an individual, $10 a day, $300 a month, $3,600 a year. For a family of 4, $20 a day, $600 a month, $7,200 a year. Folks, in 10 years, that $36,000 will grow to be $50,000. That $72,000 will be $100,000. And you have it under your control. You don't want to spend that money, folks. Believe me, if consumers have that kind of money in their savings account, they are stingy, man. They don't want to spend anything. If they want to shop. If they have 1,000 deductible, 2,000 deductible, they want to shop. They want to get the best price. And consumers are empowered to lower the costs. This is the beauty of consumer-driven healthcare. Yes. Consumer wants affordability, and they want competition, and they want a full transparency, folks. Full transparency of healthcare costs. So they need to pay. And another thing about is, if you're paying for your service, pay from your pocket. Pay it. Keep all the bills, what you have. Collect it over a period of 10 years. If you get it, if you accumulate that to be $10,000, you can pull it out from your HSA, health savings account, tax-free. You can go and buy a new car. Man, oh man, this is the ideal way to do healthcare. This is where I told Erica, instead of universal healthcare, embrace consumer-empowered healthcare Amazon. Yes, this is the way to go. Folks, if you like this concept, follow me. As a matter of fact, I'm thinking of running for governor of California. I would love to. the reason I want to run for the governor, because I want to spread the message. Not I want to be a governor. If I get that's a difference. But my message is simple, folks. Health care for all, and they have to be empowered. If you like it, follow me. Follow me. Consumers Doc 1 for Governor of California. We will see you in the next episode. Goodbye and God bless.